All right, so I'm going to get started. Hi, everyone. My name is Emily Grossman, and I direct the CBC Training Institute. We are so happy to have you all here today to talk about organizational ways to promote self-care due to COVID-19. We're so lucky to have Jim Kennedy here from CUCS, who's going to do the training for us. And we're very happy to have him. And I also want to give a shout out to Tara Reddy, who is our McSilver admin today, who's going to be doing all the technological stuff behind the scenes. I just want to go through a few housekeeping things before we get started, just so that you're all oriented to the webinar. So first of all, you will notice that this is a Zoom meeting format. We had set it up this way because we didn't anticipate the number of people who were going to join. So we're not going to be using participation today or Q&A because we have our training is going to go for the full amount of the time. However, if you are having technological difficulties, please chat to host and Tara will be happy to help you with that. In terms of getting the slides or a recording for the webinar, this webinar is being recorded. We will make the slides and the recording available to you both on the CBC website, which I'll put in the chat box. And also you can email ceus@cbcare.org and we will send you the slides and the recording. I'm going to put all of that in the chat box in one moment. The other thing I wanted to mention is we are providing CEUs for this training just to social worker, to LCSWs and LMSWs. So they are the only ones who are going to be able to receive CEUs for this, and it's 1.5 CEUs. The way we're going to work that is you will see at the very end of the webinar, I'm going to put a link to the form to apply for the CEUs. And if you're not able to fill it out at the end of the webinar, that's okay. We're going to email it out to all attendees as well. So if you have questions about CEUs, it's going to be that same email address, ceus@cbcare.org, and I'll put that in the chat box too. And let's see, in order to receive CEUs, you must attend the full training, okay? And we will have a timestamp of everyone's attendance, so we'll know who attended the full training and who did not. Let's see. Everyone has been placed on mute. For this training, you're not going to be able to unmute yourself because there's so many people on the training today that we thought it would be a little hard to manage Q&A. But if you do have questions, you can chat them into the chat box and I will do my best to answer questions if they're related to CEUs or anything like that. And if you have any questions related to the training, I will get the answers to you from Jim Kennedy at a later time. So those are all of my housekeeping announcements. I do want to go through a little bit about how this training came into being and also CBC. So Jim, if you would go to the next slide. So we have received, CBC has received funding from SAMHSA to do self-care trainings. We have self-care trainings going on from January through August of 2021. So please stay tuned. We're going to be sending out registration information for next month's trainings. They should come out by tomorrow. And then, and so on, around the mid-month, you'll get a notification about trainings that are coming out for the next month. We have a lot of great trainings and we're very grateful to SAMHSA for giving us this funding. Jim, you can go to the next slide. CBC, if you're not familiar with us, is a not-for-profit organization dedicated to improving the quality of care for New Yorkers with serious mental illness, chronic health conditions, and/or substance use disorders. We have a health home, we have an independent practice association, and many other innovative programs such as preventative case management. If you've heard of Pathway Home, we are the ones who oversee Pathway Home. And we do a lot of things in the background to support our 50 plus member agencies that are a part of CBC, such as we help support with billing, we help support with quality improvement projects, and most importantly, in my mind, but maybe not to everyone, we help support with training. So we can go to the next slide. I want to tell you a little bit about CBC Training Institute. I'll read you our mission statement. CBC's Training Institute provides innovative, interactive, culturally sensitive training and professional development to New York State's mental health providers. With an eye on adult learning theory, our trainings are cutting edge and delivered with compassion for and an understanding of complex demands on mental health professionals. It's our mission to ensure that we provide evidence-based training on a variety of topics to assist providers in supporting the service recipients on their caseload. With a love of learning ourselves, we create our trainings to be a scaffolding upon which a successful, rewarding career of service can be built. So you'll see below, these are some of the trainings that we've run in the last 6 months. We run about, right now we're running about 6 or 7 trainings a month. And I really encourage you to learn more about us. And with that, I am going to turn it over to the wonderful Jim Kennedy from CUCS, who is going to be providing the training today. Thanks, everyone.
Well, thank you, Emily, and thank you, CBC. My name is James Kennedy. I am a project director at CUCS of the Institute. I have worked at CUCS for the past 20 years, and along that time, I've done a lot of different things. I started my career way back when, and I started with substance use. I did that for many years, and then started working in housing at CUCS. Just a little bit here, while you wait for the training, check out, we are on all kinds of social media. And this is one of the ways we're going to start right on the front page. Organizationally, being on social media, being a presence out in the community is really important. We have, as you'll see, we have Twitter account, we have a Facebook account, we have an Instagram account, and we're on LinkedIn. So you can use hashtag CUCS trainings to join conversations, not at this time, but any conversations. So before we begin, first and foremost, just want to wish you and all of your loved ones well, safety and healthy, especially in these really challenging times. You know, even though the world may look like it's turned upside down at times and it's very different from what we know, the new normal. At CUCS, we feel that, you know, training is an essential part of a professional development. It's part of our collective, and it's very important to remember, especially when people have a little extra time for something, that although the landscape has changed, we're going to prioritize bringing you platform skills to promote best practices. We don't want anyone shooting for the middle. We're going to shoot for the stars, okay? And while this is going on, we all work in a field that is notoriously underappreciated. So just any kind of recognition, you know, when I watch any kind of news program, just watch the news, and they went over all the different types of essential workers, and nowhere was listed anyone in social services. So I just want to put a big thank you out there to all of you for your compassion, for your caring, for your empathy, and actually for your dedication to working in public service in this field where we're notoriously underappreciated. So this is a good time for us to stop and just say self-care is so important, especially now. We have people that, for whatever reason, all day take care of other people. We take care of people in this field. So while you're at work, you do that. And a lot of people then go home to take care of another set of people. Sometimes we're so busy that we don't even put ourselves on the list of people to take care of. That's why self-care is so important. Putting something in so that you learn how to throw flowers on yourself. You learn how to make sure that you're taking care of yourself. You know, when you're on an airplane and they do that whole introduction and they show the air coming down, the cups, and they always say, if you have someone there, make sure you put the cups on yourself before you take care of someone else. So in order to do our jobs and do them, we have to actually make sure that we are putting some point of self-care in our daily lives. So whether you have it built in, whether you just know, oh, I need to go take a walk, I can't take this right now, I need to talk to someone, whatever it is, throw some flowers on yourself. Take some time to take care of yourself. So important. Okay, so I'm going to do a little commercial for CUCS. CUCS is the Center for Urban Community Services, and we have been that since 1979 when we were founded. And we were founded as part of Columbia University Community Services. So you can tell where we got our initials from. We were started because there were a few social workers and interns. We love interns, yay. And they were on 113th Street, and they started to see a phenomenon that was going on. Now, in the 70s, there were a lot of phenomenons going on, not all of them good, not all of them bad, but this was homelessness. And we had a group of people who decided they wanted to do something to combat that. So we started with the Columbia University Community Services, and we started with housing, okay? Now, if there's a phenomenon going on in your neighborhood, you can bet that there is some form of legislation somewhere connected to that. So for us, I like history. I'm going to tell you the history. So we're going to go back to the 60s, and particularly 1963, where a gentleman who had my last name, no relation, John F. Kennedy, passed the Community Mental Health Act of 1963. And it was important for many reasons. The first of all being that it was the first real legislation to be passed as far as mental health was concerned. And it had some good things and some not so good things. One of the really good things was that it deregulated all of the state mental health hospitals across the nation. So once again, looking back to the early 60s, to the state of state hospitals, it was pretty atrocious. If you think from an era of very limited psychotropic medication, think Thorazine in huge copious amounts where people were left in what was known as a Thorazine haze, basically people being almost catatonic. They were just really warehousing people. So the thought was to take people that were just being warehoused and put them back into their own communities. And that was a great idea. The only problem is there was no follow-up. So in New York, for instance, we had Bronx State, we had Rockland State, we had Pilgrim State out on Long Island. All of those, they would take people and put them into buses. As they got on the bus, they would hand them, back then we didn't have Metro cards, with these round things called tokens. Some of you may remember them. And everybody was given a token and told goodbye and good luck. That was really poor planning. Some people did not have medications to last out 2 days. So because of this poor planning throughout the 60s, the 70s, well into the 80s, we started to see an increase in incarceration. We started to see an increase in substance use. And we saw a phenomenal jump in the amount of homelessness. Now, I'm telling this long story because at CUCS, our mission statement boiled down is to try and help end homelessness. And you see a list of things that are up there, a list of resources and such that all work toward that. So we all have the same goal. But at CUCS, well, that came out a little squished, sorry. At CUCS, at the Institute, we use education to try and share our knowledge, and that is how we aim to actually interpret ending homelessness. Now, to that end, if I were to ask all of you, what is your agency's mission statement, and what does your program do to interpret that? You'd be able to tell me, right? Without Googling it, right? Okay, so today, the training has been developed to understand, first of all, the impact of stress, and then to help managers support their workers and clients in strategies for self-care. So we're going to first help ID sources of stress in human service. And then we're going to provide some of the coping skills you may or may not have even thought of. And then we're going to try and help management to actually go in and really help with the job concerns and to cope with the stresses from a managerial and agency-wide perspective. Okay, introduction to stress. I like the visual, bright red. All right, what makes human service work so stressful? Well, I'm glad you asked, okay? Here are just the beginning. This is without COVID, okay? Pain and sadness. Seriously, again, no time. Got to go to the client. Pressure, deadlines. They don't pay me enough for this. Feeling unsupported. Feeling like you have to multitask. I can't even chew gum and walk, okay? And at the times it feels like nothing is working. Am I even helping? Another meeting that could have been followed up with an email. Help, more challenges, coworkers and personalities. No one calls you back. I feel like I have no control. Another crisis. Time to get cursed out again. Paperwork, challenging clients. These are all sources of stress even before COVID. So then we add COVID, okay? Then it's fear. Fear of being contaminated, fear for your clients, fear for yourself, fear for your family, okay? Not having enough PPEs, okay? All of these things, getting mixed messages from our government, even our mayor fights daily with our governor. Sometimes you can get overloaded by all of these things. So there are huge sources of stress that are going on. But when we actually look at it, stress is actually part of our daily lives, okay? And sometimes stress can be good, okay? So you can look at stress from a physical or a somatic standpoint. We actually hold stress in our bodies. Headaches, stomach aches, backaches. People have known to get heart attacks. Stress can kill. Emotional or moods, okay? Having mood swings, being tense, being nervous, feeling crabby, feeling sad, feeling depressed. Cognitively, it can impact us on our thinking, being confused, being reticent, forgetting things, and then behavior or functioning. And as you see there, cigarettes, the number one drug in the United States. Okay. Um, think about alcohol. I just read a recent survey that said in November that alcohol was up 500%. So people are turning to ways you can actually look at good and bad ways. Physically, behavior, you can turn it into a physical positive, or you can turn it into some negative types. But it is part of our daily lives. So we have two stresses going on, personal and work. Excuse me for a second. And they may negatively impact us as workers, our clients, our environment, and even the change in our environment, our program, and then our organization. So due to COVID-19, this has negatively impacted in many, many ways. Some of them can be looked at through a positive lens, though. So there are both going on. So why is there an increased attention right now to self-care? The answer, somewhat obvious, but there's a balance of human service staff that engage and preserve personal longevity and happiness. If you're in this field, you need to learn how to take care of yourself, much in the same way as I use that analogy of taking care of yourself before you take care of other people. Okay? Self-care is a person-centered approach, and we're really big on that. And it values staff, and it values a commitment to keep staff resilient and effective. Okay? Without taking care of yourself, without learning that part, there's a real chance that you could burn out, that you could get secondary trauma from people. So we really need to make sure, there's always been somewhat of an emphasis on taking care of yourself. But right now, with everything that's going on in the world, self-care is so important. It just makes sure it comes out as much more relevant, and much more awareness needs to be put on it today. So as I said, with awareness, we have the ABCs of self-care. And as you see, those are the masks that come down, but they come down in a hospital or in an airplane. So the A is awareness, understanding that you could do burnout, okay, secondary trauma stress, understanding that your response impacts everybody, including the organization, and awareness as a discipline, making sure that you take time to do a little self-awareness every once in a while, that you need to make sure you're looking at yourself, taking a slowdown or even a stop, taking a step back and looking at that. Then we have the B, balance, work-life balance, and balance on the job itself. So trying to make sure that you leave work at work, trying to make sure that you put things into your life that you like, hobbies. There are people that actually do not take vacations in this very stressful. So do yourself a favor, take your vacation. Make sure that you are trying to find as much of a balance between work and life as you can. And then there's the C, which is connection. We are social beings in life. So people, community, and spirituality. And right now, because of COVID, this one is impacted quite a bit. So use whatever means are possible. Use Zoom, use meeting people outside when there's a nice day, using all of the things that are open to you to try and feel the connection, because that one is impacted really, really strongly during COVID. Okay. One of the things with self-care is to be able to check in with yourself. We talked about taking a slowdown or even a step back and doing something that's known as a feelings thermometer, okay? This is good when you're not able to say exactly what's bothering you, but you know that you're bothered. And quite a bit of people have actually presented with this. Do not ignore your thoughts and feelings. Pay attention to them. They're important, they're valid, they exist for a reason. And be aware of things that are going on in your body. If you're talking to a client and you're getting a knot in your stomach, be aware of that, okay? Something is telling you something. Pay attention to your body, your thoughts, your feelings, and your behaviors when you're upset, okay? So we have a feelings thermometer that goes everywhere from I'm feeling great, relaxed, happy, 3, I'm cool and collected. And then it starts with, I'm okay. This is hard, but I'm in control. I'm getting uncomfortable. I'm starting to heat up. I'm boiling. I'm ready to explode. I'm exploding out of control. So by actually checking in, we actually can do stuff before we get to that I'm heating up. We want to actually stop when we get to that point and really, really try and get back to I'm feeling relaxed and happy or great. So there are tricks and, but being aware, taking your own temperature is the start of that. Okay. Self-care is critical to being an effective worker, okay? In order for us to be in the moment, be in the place and right and time, we have to actually make sure that we're taking care of us mind, body, and soul, okay? Spirituality, even if you do not believe in organized religion, there is spirituality. There are different things that you can do to actually make sure that you are reaching and taking your temperature in all these places, reconnecting back to the purpose of the work and the reason why you entered this field. It really helps every once in a while to think about, I wanted to help people. I wanted to be effective. I wanted to make a cause. I wanted to make a difference. Unfortunately, there are times when what we expect is overshadowed by some of the stresses at work. So let's talk about COVID. In December 2019, a novel contravirus, now called SARS-CoV-2, caused a series of acute atypical respiratory systems in Wuhan. I'm not sure exactly how to Wuhan, China, as our soon-to-be ex-president called it, the Chinese virus. The illness that can result from SARS-CoV-2 is COVID-19. New York was largely hit with the strain of COVID-19 from Europe, and the virus is most likely to spread to people in close contact within about 6 feet of a person who has COVID-19. It spreads through droplets that are sprayed when a person coughs, sneezes, sings, or talks. This is especially true when someone talks loudly. I unfortunately talk loudly all the time, so I am a cause of a big spread. So it's true, even the way you talk can impact how this is spread. And people who have no symptoms can spread the virus. I know most of you know all this. I just wanted to make sure that we went over it from the beginning. So, managing mental health during the crisis such as COVID-19 pandemic, it's common for people to experience increased levels of anxiety, even fear and distress, particularly, as I said before, as a result of social isolation. Excuse me. Frontline mental health care professionals are particularly vulnerable to negative mental health effects. So workers need to strive to balance the duty of caring for patients with concerns about their own well-being and that of their family and friends. This is really, really stressful because 350,000 people have died of this disease. So that makes a huge impact. That can turn anxiety into unmitigated fear, just thinking about that. All right, so economic woes, unemployment, health fears, they've all added to the enormous stresses of the pandemic. And this is the first global pandemic in a century. Okay. So many unknowns. And I'm going to put in here many misconceptions that were brought about COVID-19, cause the anxiety to go right up to fears and stress, okay? Social distancing, which is really, really hard to socialize, lockdown measures, although necessary for private health, cause isolation, loneliness, and depression. Once again, even from people we're supposed to trust, you get misinformation and contracting information that causes confusion, heightened anxiety, uncertainty, fear, and then even mistrust. And then there are cultural and demographic issues. So on top of stress from the job, on top of stress from COVID, we have new stressors that add to this. So some stresses are impacted by ethnicity. For example, police violence, police brutality, which has been in the news a lot. 37% of whites report as a source of stress versus 71% people of color. Linking income to stress. Lower income people experience higher stress rates. And then, although generally equal, studies also show that women consistently report stress levels much more easily than men. People of color are more frequently identified and report common stresses, for example, financial issues. Young people, including millennials, thank you, more frequently identify and report common stressors. Okay, so COVID-19 has made our work even more challenging. Compounding stress, increasing anxiety. Field work can now be traumatic, and for some of this, it can be triggering. Just going out there, connecting with clients in treatment are all gravely compromised, especially if there is not enough PPE, personal protection, and not enough face masks, not enough gloves to go around. And then we have the added thing of working from home. It can feel lucky in some ways, but that can have its own stressors. Staff with children going to school or being home, isolation, trying to get into a new schedule that can be overwhelming for people. I remember when I first started, I actually left March 9th. I was one of the first people to start trying to work from home. And the first 3 days, all I wanted to do was stay in bed. It was overwhelming and depressing, okay? Who knew that I liked going to work? You know, sometimes you find yourself saying things you never thought you would say. I really do miss going to work. I really miss the people at work, but. So, finding space. As you see, I'm coming to you from my bedroom, okay? Finding ways to connect are all extremely challenging. And this heightens the anxiety. I can't talk about this enough. The anxiety that turns into fear. Most of us do not like change. We like things at the status quo. So even though we've been dealing with this for almost a year, some of us for a year, some of us a little less, going out of your comfort zone, and even after a year, it's still challenging. It's still overwhelming. It can still be frightening to a lot of people. All right, these are some of the things that we have heard over and over. Okay, they've become like the mantra. Stay 6 feet away from people. Okay, keep in-person interactions to less than 10 minutes if it's possible. Avoid indoor gathering. It's a season of indoor gatherings. It's winter. See, the issue is that we're actually in somewhat of a lockdown. So places that we usually meet outside, a restaurant, a bar, a club, a dance revenue, these are all closed to us, okay? So then where do people go to interact? Home. And that becomes another problem when you actually can't interact at home. People get very, the government can't tell me how many people I can have in my house. Yet if you have large parties, this will end. But people are being short-sighted. They've had enough. So they want to actually go out and do things. On one hand, you understand that. On the other hand, you're putting more and more people at risk. So wear a mask, wash your hands, don't touch your face. All of these things are things that have become the new normal for us. They've been drummed into us. But even that, there are people who feel that they don't need to wear a mask, that it is against their personal rights. So trying to help educate people, or people are so afraid of seeing people with a mask. Once again, people cling tenaciously to what they know, and they are frightened of change. So taking a little bit more time, especially with people that are older, that have a little bit more to lose and are a little slow to pick up change. You need to actually take your time with them and show compassion. And sometimes it's hard to do, especially when you feel like your life is being threatened at the same time. If you leave home, know your 3 W's. Wear a cloth mask, wait 6 feet apart. They actually did that so the weight would be a W. And then wash your hands. Okay, so these are all ways that we see. This is I took from a poster that was down in my lobby. Okay, so once again, we're talking about, you can see the virus. We actually got a picture of what it might look like right here. We're all in a stress response right now. And when your survival gear is up, once again, let's go over. You have the normal stress of being a social worker or in social services. You have an added stress of COVID-19, and then all of the other stresses society is actually going through. We just had people attack the nation's capital. That has an impact on us as people. So there are all these outside stresses. So when survival gear is up, cognitive functions can change. Our capacity to think clearly is different. And we are a nation divided right now, so it depends on whose news program you watch and what kind of information you get. What you choose, what newspaper you choose to read has a different viewpoint. So all of this is adding up to the territory of trauma. It's no one individual's fault. And as a result, we can't take it in and we can't integrate what's happening around us. And you've noticed that there may be a challenge in how you process things. Excuse me one second. Integration won't happen until later. Right now, we're just in the event. So, welcome to the new normal. So, for all of us, feeling numb, feeling anxious, feeling on high alert, feeling collapsed, feeling sad and depressed, feeling clingy, feeling impulsive, feeling paranoid, feeling nonchalant. All of these feelings are normal. Whatever it is that you're going through right now, because this is unprecedented, are normal. Even reaching for your addictions is normal. People are overwhelmed. There's so much to take in that processing all of this can really, really throw people. So we have to learn how to adapt. So one of the things here is to meet yourself with some kind of compassion, all right? Seeing a range of your responses in yourself at different times of the day, it's very consistent with what we call being in the active stress/response. So you can even enjoy certain experiences you're having, while other parts are not so joyful to the point of being overwhelmed. So we're very complicated human beings with many parts sitting side by side. Most of us not understanding how that can even happen. But because the trauma is currently happening still, the goal is to just meet yourself, all your coping mechanisms, all your strengths with compassion. Meet yourself with compassion again and again. So that's what I mean by throwing flowers on yourself, being a little kind to yourself, taking some time, doing a self-assessment, finding out what exactly it is that you're feeling, because you're feeling so many things all at once. And as fast as they come, they can then change also as fast. COVID-19 and older adults. Now, I'm going to let you know, I'm an older adult. And I'm particularly viable to this because the COVID-19 and older adults, the virus carries a much greater risk for older people and much more hospitalizations, often with fatal and tragic frequency. Now, a lot of the older adults, part of what it is that they have compromised immune systems already to begin with. So there are issues. You have high blood pressure, you have diabetes, you have compromised immune systems every day, okay? According to the CDCP, 8 out of 10 of Corona-19 deaths in the US have been people 65 and older, okay? So hanging on to health, really, really making sure that staying safe, staying isolated, wearing a mask, washing hands, and social distancing are now the new normal. So let's just slow down right here and let's talk about that, the new normal, okay? The new normal means that you are actually doing things that really can be really, really scary and making you feel more isolated and more lonely, especially at 65 plus. So a lot of times you see the fear. The fear can be overwhelming, especially when we've actually seen that people know that older people are impacted much more frequently and much more at a higher rate. So hanging on to your health, how does that, when people say that, what does that mean, hanging on to your health? It means trying to actually eat right, some of the basic things, eat right, trying to exercise, even if you just go outside and take a walk outside, trying to make sure you get rest. If for you the anxiety raises when you watch TV, limit your TV watching. I can tell that even for myself, the more I watch TV, I'm sort of like addicted to it. But it doesn't really help. Sometimes it can actually hurt. So helping clients while dealing with our own emotions can be particularly dealing and very challenging. An example, I remember at 9/11, I was so impacted the day actually on 9/11, I ran to the American Red Cross. And I wanted to do something. And they actually put us into groups, and then they put us out into the field, into public schools to actually help with the people who survived. They thought there was going to be a lot of survivors. Excuse me. And I remember before they let us go, they came to us and they said, most of you are social workers, you have a license, but this is really different because what's impacting other people is also impacting you at the same time. So we have to look at this from a different way. So it's really easy when you see someone who's in a hurricane to get swept up in that hurricane. But you are not going to be able to help anybody when you're in the middle of a hurricane on the roof. We need you to try and keep your feet on the floor. That's the way you can help people. I thought it was such a great way of looking at it. It was kind of like what's going on now, because COVID-19 can be looked at as a hurricane. And if you get so caught up, you go up into the hurricane, you're not really going to be helping anybody. But it's very tricky to be in the middle of something that everyone, including yourself, is going through. It takes a certain kind of self-awareness to take that step back and to really, really try and center yourself and calm yourself. And as they told us that night, you can't make it, fake it. Well, we were only doing it for one night. So, all right, based on the measurement of the CDC, seniors are a high-risk group for poor mental, physical, and emotional health. So one of the things, stay informed, but don't stay on the TV too long, and take practical steps to protect yourself and loved ones. Engage in healthy activities, meditation, walking, doing light exercise, even routines in your health. In your home, they're all beneficial to mental health. Make sure that you have at least a 1 month supply of prescription and over-the-counter medications you need to manage your mental health and ongoing other conditions. So this is for the older adults, can be staff as well as clients. In supported housing, the majority of people are over 50 years old. So this is really, really important to understand, especially with medications and helping people to feel calm and to trying to press new things. As I said, people cling tenaciously to what they know, and especially in times when they're frightened. So having you there in a calm voice, letting them know that, they're not alone, that you'll help them with that. Or even knowing for yourself that some of these activities can really, really help, are really important on both sides of the fence. Okay. Stick to routines because routines are important, okay? Stay connected, even if it's on Zoom, okay? Family, friends, and support networks, faith or hobbies or whatever you have. Consider asking one person to be your support buddy and have some daily check-ins. If you're a member of a peer support group, stay connected through the phone or video platforms such as Zoom. You have to remember to try as much as possible to be positive. And one of the great things that the positive that has come out of this pandemic is people can actually reappoint and start to reassess priorities and start to relish the simple things that life provides. Happiness, play some music. I want to stop here and I want to talk a little bit because we're getting into how management of an agency at CUCS. This was so it really hit me in a really profound way. They went around because we are on so many social networks. We had one person who was in charge, and she actually went around and had each team, and there are lots of different teams, come up with a playlist of music. And it's really fun to actually watch because you know people in different sections, and you can see, and there's a huge variety of songs that people come up with, very, very different. But I do remember one in particular that stood out to me. Yeah, I'd like to look at them and see what the songs are and even play some of them. It was really, really a way of getting your mind off of too many things. Believe it or not, music can be very, very calming. And there was one thing that was put together, and most of it was, some of it was hip hop, some of it was very popular, but there was one song that was Smile, which was actually written by Charlie Chaplin. And it was a duet by Barbara Streisand and Judy Garland. And they sang it in a very slow tempo. And I remember watching the Judy Garland show, believe it or not, and hearing this. And it was very emotional and very healing to hear, smile while your heart is breaking. It was actually a really a therapeutic happiness that came about. But just something that you wouldn't normally think of as very helpful can be that way. Help others through peer support, checking in on your neighbors, childcare for medical personnel restricted in hospitals who are in the huge fight against COVID-19, okay, when it's safe for you to do so. All right, helping staff. Okay, really big thing to consider is fear. When anxiety is uncontrolled, it becomes omnipotence of uncertainty, the fear of the unknown. What will happen if staff becomes ill or lose their job? The unknown persists. How long will I be ill? Will I be able to get another job? Can I infect my family? Can I take care of my family? Our aversion to uncertainty is powerful, so is the drive for control. And the more uncertain a situation, the more afraid we become and the more control we seek. So what do you do with all of this? You need to start focusing on what you have control over. Okay, so one of those is breathing. Believe it or not, the simplest form, because it is the key to all other forms of meditation and relaxation, even yoga. Excuse me. So slow, deep, diaphragmatic breath work is a quick and easy way to calm strong emotions such as fear. So believe it or not, I'm going to ask all of you to do this. So Please sit with your feet firmly planted on the ground, your back straight against your chair. We're going to inhale to the count of 3, not 4, sorry. You're going to inhale through your nose. And you're going to hold that briefly, and then you're going to slowly exhale to the count of 4. You can do many things. You can softly or silently say let and go as you inhale and exhale. You can think of colors. Inhale when you're breathing in, white snow, and then fiery red when you're exhaling. You can imagine inflating an inner tube or blowing out a candle as you do this. So we're just going to do this. We're going to do 5 of them. So if you can, close your eyes. If not, just lower your eyes. And I want you to start breathing in, 2, 3, and out. 2, 3, 4. In, 2, 3, out. 2, 3, 4. The rest you're going to do by yourself. Do 3. Practicing this with your clients can be a way to calm your fears, especially when you're dealing with people who are impacted and really overwhelmed by this. Sometimes we just forget to breathe. So breathing through this is a way that you know you have some control. Meditation, any type will do. Make it easy. You can download meditation. You can use Spotify. You can use guided meditation on YouTube. The goal here is to pause, to turn inward, and to ground yourself in stillness and wisdom. Gentle movement, activities, walking, yoga, massage, stretching, even dancing can help us to find some ease and space in places of tightness. I can't stand this lockdown. I feel very constrained by the stay at home, but I'm going to use this opportunity to have a staycation, okay, where I'm going to focus on taking care of me for at least a half an hour to an hour per day. Very important. Oops, sorry. I'm going to die. What is the likelihood that I will actually die? I agree that although many people will become infected, the probability of dying is low, especially if you're someone who is otherwise healthy and you pay attention to the recommended guidelines, okay? Make sure that those classic 6 are being taken care of. Trauma-informed yoga by Vanderkolk, who actually wrote a great book on this, about feeling things in the body. It incorporates breathing exercises, meditation, concentration techniques. It helps with emotional regulation, okay? You have the awareness of your body combined with the transitory nature of thoughts, feelings, and experience. And it integrates the mind, body, and the heart. Change your thoughts. Try and turn off work when you go home. Focus on the here and now. Focus on making priorities. What's important? What's important to you? Stop assuming you're responsible for other people's problems. Or if you have a perfectionist attitude, and I find a lot of people in social services have this, you need to alter. It's okay to not be perfect all the time. Try and look for the positive by using a strengths-based approach. And even do that with yourself. Give yourself some affirmations. and try and remain as calm as possible. Be that as your mantra, be that as your self-awareness check-in. Am I being calm? How can I be, and actually, what does it take for me to be calm? All right, so we're going to follow up with some of the organizational and managerial ways. Okay. The COVID-19 pandemic, it highlights inequities, exclusion, discrimination, unemployment. So one of the things that your agency from a managerial can actually do is develop some committees to actually start working on inequities. What can you do? What can you do in your workplace? How can we bring these in? How can we talk about those? Make sure COVID-19 updates are from a reliable source. At CUCS, we have a medical director. So he puts out pronouncements every week. He does updates. So make sure that you are checking in with your doctor, making sure that, a lot of times, I'm telling you this morning, I heard the mayor and the governor say two different things. It can be very confusing, okay? Appoint one spokesperson to disseminate information agency-wide. This way you don't get those conflicting, everything goes through a single point of entry. At CUCS, we've done this and it's been really, really remarkable. So this way the agency is taking control of, the information that we're getting, and we're making sure that it's reliable and firsthand. And we actually are being told where the information is coming from, except for the medical director, because the medical director transits it's other things that the staff person actually talks about. Start a drive to get PPEs for both clients and staff, which has been very successful at CUCS. We have a drive where we had people out in the community who wanted to donate and didn't know where to donate. So we've actually had, we set up a ground control. We've had volunteers. Staff have volunteered to actually take them in and redistribute them. Develop a voice on different social media. That was one of the things that we started out with in the beginning. CUCS has become involved in social media. We actually do a highlight, a staff person or two staff people from each program, and we put a little thing about them and what they do and how they help. We put it on social media. It's so great to see yourself and feel like you're contributing and you're getting recognition and affirmations through social media. It's really, really rewarding. Everybody likes to get a thank you now and then. Even people who are totally embarrassed. We have some of them that didn't really want to be on social media, but they talked about how fulfilling it was being on that. Let your clients know that you're aware of COVID-19 and the measures that you're going to actually keep your office, if you still meet people in your office, as safe as possible. Or also that you're following CDC guidelines when you meet people out, and encourage and insist on them wearing a mask when you're wearing a mask. It's okay to do that. Cleaning and hygiene, follow the guidelines on cleaning and hygiene protecting in the workplace. We have one person that has been appointed to create a weekly list for all staff on webinars on wellness. So even this one was included in the weekly staff webinar on wellness. So topics such as trauma-informed care, self-massage, mindfulness, self-care, yoga, social justice, COVID-19, all of these things are a weekly list that people can actually use. The majority of them are free. There are some that do have that, and then they're required to get their program director's approval. But a lot of times these can be really, really eye-opening and give you a lot of information. So you feel you're being supported once again from management. Learn Zoom. Each team member to take a turn being host. Learning Zoom, especially in the beginning. I mean, we're almost into a year, and most people are pretty well into that. But if you're not, that's another good way of making sure that you feel supported and connected. You're the host. You put people into breakout rooms. You can show a video. You can do all of those things, making sure. Instituting staggering shifts. People have all different kinds of needs. So making sure that you actually stagger shifts for people, you take into account what they need and talk to your staff. Sometimes we have one staff go in 1 week and two other staff stay home and work from home. So staggering those and letting people actually know that when you go in, you're going to hit the ground running because not all the staff is there and you got to take care of all the problems. But you're actually making sure that people have enough chance to work at home and feel safe, and then at the same time going into the field to feel safe. To ensure that your workload is in line with the staff's capabilities and resources. Not asking people to do things that you normally wouldn't do. There is, I know at least several staff members who have been in charge and they were given the option of not going in to their, to work. And they actually thought, why would I ask somebody to do something that I wouldn't do? So they put themselves in that. Make sure that you clearly define workers' roles and responsibilities, because in an ever-changing atmosphere, this can be really, really helpful and grounding, giving people much needed support around having a structure. Make sure that if you have new policies and procedures for COVID, that they are actually gone over in meetings on Zoom. You can't expect people to just arbitrarily read them when you send them out. Make sure you go over them. Not that you're treating your staff like children, but I know even for myself sometimes, I don't fully read all of the emails. And it's very helpful to remember people learn in different ways. So if somebody is, much more, can learn much better from going over instead of just reading it. You want to make sure that you are taking into account adult learning methods. And being as flexible as possible with staff time. There's been huge shifts in children going back to school, and we do have quite a few people who have children. So, as much as possible when, right now, I can't even tell you if public school is in or not. And even if the public schools are there, there's about 100 of them that aren't, having children on site. So it's something you need to make sure you're checking in with your staff and making sure you're understanding and not compromising children and children's health. Okay. Zoom meetings as needed to provide emotional support. So maybe it may not be enough to have one. I know for my team, we actually check in at least twice. And that promotes people actually doing peer-to-peer check-in without you even having to mention it. All right. Schedule some of the things that you used to do, lunches. Believe it or not, happy hours. You don't have to drink. We just call it happy hour. Okay. And ugly sweater party. We had that at Christmas. because it's something that we always did, having a birthday party. Schedule these things to make sure that management seems that they're overseeing and they're providing emotional support. There are new time management issues that come up. Structure, prioritization, isolation. You have to take into account all of those. Peer support, addressing fears, and field work. So trying to meet with people at least twice a week, sometimes more if they need it. If something is going on, particularly with someone and you have a close team, you may want to do that arbitrarily, a little more some weeks, a little less some other weeks. But it always helps to have people to feel that they're being supported. Even if we, today we have a support meeting and sometimes you forget them, but right at the time, sometimes you may not want to even go on to them. There's too many of these meetings, but most of us feel better once we're actually engaged. It's amazing how that works out. You feel supported and you feel heard. Some of the support at CECS, we've had a PPE drive to try and get that. We've had basics learn telehealth. We've encouraged staff to attend trainings by putting out weekly trainings and webinars. Webinars themselves on wellness. Having the time to talk and then respect not talking when people get overwhelmed, but that means knowing your staff. One of the things that CECS has done, mental health days, extra time off. We give 2 more. We gave 2 at the beginning and now there's 2 more. Listening to learn, so important. Critical incident debriefing with staff on Zoom, address staff concerns, safety, fear, and needs. Help staff have control over their work days. Keep them informed about policies and procedures. Don't just send them in an email. Don't withhold information from staff. Keep them informed about how decisions have been made. Offer EAPs with mental health care services, if necessary. Don't forget the obvious. All right. Excuse me. Be compassionate. Monitor your news consumption. Mind what you eat and drink. Rest. Connect with positivity instead of fear. And stay helpful, hopeful, and helpful. Sorry. Support through supervision. Okay. Regular supervision is important during COVID. It combats isolation, creates a safe haven, and it helps the supervisee to take care of themselves, take risks, and grow professionally. You need to address both strengths and needs, and they will learn to do that themselves. Allows for early intervention in problems, and you can stay informed of what's going on and what's going on in their life, as well as their work life. Make sure that if it's something in their life, because that will impact, you don't want to turn into the therapist, but you do want to move it on to how it's going to impact them in their work. The purpose of supervision is basically to hold staff accountable, orient them, and in times of COVID, it's very disoriented, to some new coping skills. Okay, use a lot of when your client seems upset. Use reflections, connect them to new resources, help them identify any learning and goals. To make supervision a reality, it's helpful to have regular supervision be the norm. And supervisors have to have sacred time. That means put your phone away. Try and make sure that you concentrate when you meet with supervisees. Sometimes it doesn't even have to be total work related. I'm just, how are you feeling? And people can actually use that as an opportunity to vent. Don't let them vent for an entire hour. After 15 minutes, okay, now I got what's the problem. So let's talk about the solution. This way they're actually oriented to finding solutions. And supervisors need to know that they have to have an individualized approach, because people are individuals and they deal with things in different ways. The relationship, be welcoming, express warmth, tune in with empathy, because what happens between you and the supervisee is going to happen between the supervisee and the client. Address their feelings. We always start at CUCS by addressing feelings. We don't go too far. Once again, you're not a psychotherapist, but how people are feeling is going to impact their work. Listen reflectively. Be curious. Ask for elaboration. These are all MI skills, right? Collaborate. Reach for feedback. Focus on strengths and assess their skills. Supervision addresses strengths and offers feedback. 1 hour a week should be sacred. Supervisors need to receive training in supervision. And if you have something you need to, you can use a sandwich approach. Positive, negative, positive. And consider reverse supervision to help staff get its needs met. Now, reverse supervision. We had a mayor in the 70s. His name was Ed Koch, and his famous line was, "How am I doing?" You can ask that of your supervisees. Am I actually giving you everything you need? What am I missing? Am I doing that? Tell me what you need. Can you articulate that? And it may take time before they'll actually do that, but eventually they will. Quick story. I had a woman who actually, I kept saying, how am I doing? And she was, oh, you're great, you're great. And then finally one day, after like 3 months, she was like, I want to tell you the truth. You're really way too easy on me. And my first reaction in my mind was, that'll be the last time you say that. And then I just thought, well, wait a second, you asked for it. You can't then hold her accountable for being truthful. Okay. So no retribution in there. Okay. And interactive, where you're doing things, we strive for interactive supervision, because what happens between you and the supervisee is going to happen between the supervisee and the client. A leader takes people where they want to go. A great leader takes people where they don't necessarily want to go, but they ought to be. Rosalind Carter. So to be a good leader, model the way. Okay. First step is not asking staff to change, but changing yourself. Inspire a shared vision. Ask for feedback. Ask for, really try and elicit. Challenge the process. And now enable others to act and encourage the heart. Okay. What's next? COVID-19 has forced us to adapt in ways that are not always ideal. And the stress and anxiety may have a negative effect on our daily lives. So self-care is vital. Develop and implemental self-care plans for staff. There is a light at the end of the tunnel. We are in this together, and we will get through this together. That was from good news. A vaccine is coming, and hopefully will bring about some normalcy to our world and our lives. We got to hang in there together and take care of each other. It will end. Okay. So that is it for our presentation. So I am actually going to pass this over to Emily, who will actually tell us about some of the things that we all need to hear. So Emily, take it away.
Thank you so much, Jim, for that informative presentation. We are going to now, I just wanted to give a few notes about CEUs. We're now going to put a link in the chat box to the application for CEUs. CEUs are only for LCSWs and LMSWs at this time, but if you can please click on the link and we will have CEUs distributed to you. I'm sorry, the link that just went into the chat box is not the correct link. We're gonna put the link into the chat box again. It is a Microsoft form, and we'll give everyone a few minutes where the webinar will stay open to fill it out. And then from there, if you're not able to fill it out, we are also going to be emailing the link for CEUs to everyone. So if you would please just look out for an email from us. Tara, are you able to put the link in the chat box? Okay, hang tight with us for one moment. Yeah, let's see. I just want to double check. Yeah, so that is the link. If you guys would fill out the form and you can get your CEUs, it's where it says sorry for the difficulties. If you click on that link, that will direct you to the forms. And also please allow us for a little time to process your application. It'll take us a few weeks because we have many people on the webinar today. So, but if you have any questions about CEUs, please email us at ceus@cbcare.org. It's in the chat box as well. And thank you again so much for attending today's presentation. We'll be giving out to LCSWs and LMSWs 1.5 CEUs. So thank you so much. We're going to leave the webinar open to give you guys some time to fill out the form. And then we're going to be emailing the CEUs directly to you. Okay. Thank you so much. And thanks to Jim at CUCS for providing training for us today. Bye, Jim.
Just wanted to say thank you so much. It was wonderful, and thank you for allowing us to actually bring this presentation. Bye-bye now.